Friends, if you or someone you know is getting slowed down or is not able to walk properly and you think it's because of the age, then you can be wrong. And there are high chances that you are wrong. The most common reason for one becoming slow with age or being able to walk less due to age is generally spinal canal stenosis. Spinal canal stenosis is a condition in which there is a significant decrease in the diameter of spinal canal. Spinal canal accommodates the nerves which come from the brain and goes towards the legs. Once the space available for the nerves decreases, it causes a very tight compression on the nerves which can decrease the ability of a human being to walk longer distances or at a one go. So what happens, the patient or the person who is suffering from this accommodates by taking short breaks between his long distance intervals. Suppose a person was able to walk for 5 kilometers before, but now he can only walk for, let's say, 1 kilometer, then he has to sit down for 10 minutes and then he can again walk. This is a classical presentation of spinal canal stenosis. Now, what is spinal canal stenosis? Spinal canal stenosis most commonly happens due to hypertrophy of a structure known as ligamentum flavum, which is located in our vertebral column, and it becomes thickened with age. It has a very important role in maintaining the flexibility of the spine, but as we age, it becomes thickened and loses elasticity. So instead of helping us to keep stable and walk, it makes us difficult to walk. Now, how to diagnose it, whether you're suffering from it or not? So there are three very simple ways of doing it. First, the patient's problems. If the patient is experiencing the classical problems of pain in leg while walking, heaviness in thighs while walking, decrease in distance of walking, then he is most likely suffering from spinal canal stenosis. Finally, we see at the posture also. Because of the thickness in ligamentum flavum, the posture from straight becomes a bit stooped forward, which although helps the spine to accommodate the nerves, but causes global imbalance of the whole body, which puts excessive pressure on the vertebral bones and can also lead to something known as vertebral compression fractures, where the spine bones are compressed, which is very commonly seen in osteoporotic patients, especially females who are just after the menopause. But it can also happen in males who are more than 65 years old. And after the posture, the next thing that we should evaluate in such patients is the MRI. On MRI, we can very clearly see whether the space available for the nerves is good enough or not. If it's compressed, then we can grade it from grade 1 to grade 4, and depending upon the grade, we can guide the person towards the treatment itself. The patients who have stenosis of grade 1 or grade 2 can be managed with physiotherapies and specific interventional procedures which are epidural in nature, where we inject some drugs around the nerves and try to give it more space and with less of intervention, less of invasiveness. But if you are already late in seeing a doctor, or for some other reason the treatment has been delayed and the stenosis has become grade 3 or grade 4 now, then sometimes we have to offer decompression surgeries where we remove the ligamentum flavum, but we can do it with the help of endoscopic techniques in which the trauma is very less, the incisions are very small, and the patient is walking within few hours of the surgery and can go home within 24 hours. And finally, in very few patients, the disease has such a severe grade that we have to offer them stabilization or fixation of the spine. But all this comes only after we have reached the root cause of the problem. Treating a patient without diagnosing a problem is never going to give results, and treating a patient without diagnosing the problem, without grading the problem, is a very bad attitude and never gives the results. So to get the results, the first thing is to diagnose the problem. If you or someone you know is suffering from the problem, a similar problem of pain in the legs while walking, decrease in speed of walking, decrease in walking distance, numbness in legs, and heaviness in legs, then you can send us following three things to help us guide you further in the treatment plan. The first thing we need from you is the video of their walking from front and from the side. Second, their pictures from front, from side, and from the back. And third is their MRI. Once we have all these three things, we can collaborate them together and try to find the exact source of their problem, to understand whether they are having a stenosis or not, and if yes, what's the grade of stenosis. Depending upon that, we can guide you whether the patient needs treatment, and if yes, what kind of treatment will be beneficial for the patient. We care about you.